Hello, my name is Ruben Salazar. The drug I will discuss during this presentation is allopurinol. Trade name is Zyloprim. The chemical class for allopurinol is hypoxanthine derivative, xanthine oxidase inhibitor. Its therapeutic drug class is anti-gout. The reason this drug is prescribed is to control hyperuricemia caused by patients receiving cancer chemotherapy. Patients receiving chemotherapy may be prescribed allopurinol because of the increased amount of uric acid being released from dying cancer cells. The overall action of the drug prevents the patient from contracting the painful condition known as gout. Another action of this drug is to prevent kidney stones from being formed in the body. The main action of the drug prevents the above normal uric acid from being produced in the cell. Allopurinol is administered both PO and IV. For PO, according to the nurse's drug handbook, allopurinol has an initial dose of 100 milligrams per day and is increased weekly by 100 milligrams until the uric acid is less than 6 milligrams per deciliter. The maximum dose given is 300 milligrams, with a maximum daily dose of 800 milligrams. IV administration dose is dosed between 200 and 400 milligrams daily. Here are some ways the nurse can improve patient compliance. Encourage the patient to take their prescribed dose after meals. Also encourage the patient to drink plenty of water, usually 8 to 12 glasses of water per day to produce 2 liters of output daily. It is also important to educate the patient that this drug may take up to 2 weeks to fully decrease the uric acid. This enforces the importance of continuing to follow the prescribed regimen to obtain the full effect of the medication. Also, patients should not consume foods that are high in purine. Such foods are fish, seafood, shellfish, sardines, mussels, and some meats such as bacon, turkey, and organ meats like liver. This also includes all alcoholic beverages. Quiz time! Question 1. During discharge instructions for a patient with gout, the patient should understand foods they should avoid eating. Select all the foods below the patient should avoid. A. Sardines. B. Whole wheat bread. C. Sweetbreads. D. Crackers. E. Craft beer. Or F. Bananas. The correct answers are A. Sardines, C. Sweetbreads, and E. Craft beer. A patient with gout should avoid foods high in purines. These include most red meats, organ meats, liver, kidneys, and sweetbreads, and alcohol, especially beer. Question 2. A patient is post-op from surgery. The patient has a history of gout. While performing a head-to-toe assessment, you assess the patient for signs and symptoms of gout. As a nurse, you know that gout tends to start at what site? A, the elbow, B, the big toe, C, thumb or index finger, D, the knees. If you said B, big toe, that is correct. Most patients tend to have an acute attack of gout that begins in the big toe. Remember that patients who have a history of gout or who are experiencing a hospitalization are at risk for an acute gout attack. Therefore, the nurse should assess the patient for this during the head-to-toe assessment. Question 3, our final question. You're developing a nursing care plan for a patient with gout present in the right foot. What specific nursing interventions will you include in this patient's plan of care? Select all that apply. A. Encourage fluid intake 2 to 3 liters per day. B. Provide the patient with foods high in purine with each meal daily. C. Place patient's right foot in a footboard while patient is in bed. D. Administer PRN dose of aspirin for a pain rating greater than 5 on a 1 to 10 scale. Or E. Apply alternating cold and warm compresses to right foot as tolerated by the patient daily. All right, here are the answers. The answer is A. Encourage fluid intake of 2 to 3 liters per day. C. Place the patient's right foot in a footboard while a patient is in bed. And E. Apply alternating cold and warm compresses to the foot as tolerated by the patient daily. Option B is wrong because the patient should consume foods low in purines. Remember, purines increase uric acid levels. And option D is wrong because a patient should avoid aspirin. Aspirin, even in low doses, increases uric acid levels.